Welcome to the Golden Nest platform, your ultimate channel where you kickstart your day with positivity, well-being, health tips, wellness, and a lot of inspiration. I am your host, the Golden Nest. I'm here to help guide you lead healthy, happier lifestyle. Please do well to subscribe and also ring on the notification bell below to stay updated on all our videos. Join us today is Dr. Ethel Osei Tutu, specialized in women health. Doc, welcome to the Golden Nest platform. We are happy to have you today.
Thank you. Thank you for having me.
Doc, what is our topic for today? What are you going to educate us on today?
So today we are discussing breast cancer. Since it's a Breast Cancer Awareness Month, we'd like to discuss breast cancer and the ways to prevent it.
Doc, please go ahead and tell us what breast cancer is and how does it develop?
Okay. So cancer, what is cancer? Basically, cancer is an abnormal growth. So you can have a growth which is abnormal, which may or may not be cancerous. So for breast cancer, you have an abnormal growth and it's excessive. So that is what breast cancer is. And it's the commonest cancer in women. Yes, it happens in men as well. So when you take 900 women, so when you take 100 people diagnosed with breast cancer, 99 of them would be females, but 1% would be males. So in as much as we are geared towards women, the men also have to check.
The men have to check themselves too, because it can happen.
Yes.
Oh, okay. What
Yes,
are the different types of cancer, of breast cancer?
Okay. So for the types of breast cancer, it depends. So it depends on the structure of the breast. So the breast is made up of fatty tissue. It's made up of what we call lobules, where the milk is stored if there's milk produced. Then we have the ducts where the milk travels to. So different portions of the breast can be involved in breast cancer. So we have like the technical terms. We have the ductal adenocarcinoma, which is the most common, which takes majority of the cases. But we have other types of breast cancer. So some of them have different presentations, but in all, they end up causing harm and being spread to the rest of the body. That's when it causes death.
Okay, so the one you said that is the common one. Is that the one which leads to the cutting of the breast?
So they all can, if not detected early. So it's the end result. So most of them have the similar symptoms, but the end result, if not detected early, is what may lead to cutting of the breast or death.
Okay, so Doc, you did mention of symptoms. Can you tell us what the symptoms, some of the symptoms we should look after?
Okay, so usually sometimes it's asymptomatic, so there are no symptoms at all. So for you to catch it early, you shouldn't have symptoms. That's why we have the screening program. So most people, it starts with no symptoms because it starts as a tiny growth and then it multiplies. So as it gets bigger, you could now have sensation of a mass. You can feel a mass inside your breast, what they call a breast lump, may also be seen. Sometimes when it gets further, the bigger it becomes, the more it spreads to other tissues. So it starts affecting the skin. So you may see skin changes, like you may see a dimple in your breast. I mean, people take it lightly. They feel it's a different, like, you know how we value dimples. So they see a dimple, they don't take it seriously. It could be like a breast discoloration and a different texture. So it may feel like the peel of an orange. For that one, you should also suspect it. When you look at both breasts in the mirror, when it affects one breast, you realize that one breast may look different. So when you lift up your hands, you realize that one breast is stuck and the other breast is moving. So that could also be a suspicion. That means it's getting attached to the underlying tissues, okay? Also, you may have ulcers, so it can form a sore when it gets really bad. When you look in the mirror, when it starts getting attached, you realize that the nipples are pointing in different directions. Usually the nipples may not point in the same direction, but everyone knows how their breast looks. So when it starts deviating too much, then you'd have an idea that something is going wrong. And then you may see a discharge. So it may be a bloody discharge, it may be a greenish discharge, it may be offensive, it may have a bad smell. That could also let you suspect that you have breast cancer. And then when
Oh.
it starts spreading, like, it depends on the tissue it spreads to. It can go into the lungs, it can go into the liver. So that's when it starts to spread or metastasize, as we put it. Yeah, so those are some of the symptoms
So when it gets to
of breast
that
cancer.
the stages that is called stage 4, stage 5, then it has already spread.
Yes, stage 4. Stage
Stage
4 is
4.
when it spreads to other organs.
Yeah.
Yes.
Okay. Doc, who is at risk and how does family history impact the risk of getting cancer?
Okay. So as I said initially, being a woman is a risk factor because a disease that affects women 99 times and affects a man once, it makes being a woman a risk factor to develop it. Then age. As we grow older, we are younger people who end up having breast cancer tend to have more aggressive types. Theirs is more likely to spread very fast. Then we have family history, as we mentioned. So family history has a very big impact. If you have a first degree relative with breast cancer, your risk increases about 2 or 3 times more. So a first degree relative is either your sister, your mother, not your grandmother or your niece. But even for the extended family, there's also a higher risk. For some families, they have this cancer gene running through the family. It's called BRCA. So BRCA1, BRCA2. If you have a family history, let's say your auntie had it, your mother had it, your sister had it, then you have to check for that gene, the BRCA gene, because if you have the BRCA gene, you are likely to get breast cancer. Not just breast cancer, they're also at risk of getting ovarian cancer. So for example, Angelina Jolie had found out she had this BRCA gene, so she went to do a double mastectomy. I mean, that's removal of both breasts before any symptoms develop. That's a bit extreme, but that's a way to prevent it if you have a very strong family history. Then you have the reproductive history. So it said that women who have children earlier, women who breastfeed, are at a lower risk. So if you haven't had a child before, if you don't breastfeed, your risk is higher. Basically, the reason is because during that time, your menses doesn't come, so it means the hormones are lower. So your exposure to hormones is reduced. Yes, so that being said, those that take hormonals, so sometimes the oral contraceptive pill, the hormone replacement therapy that's taken in menopause can also increase one's risk because of the hormones. Then you have things that you can modify, like being overweight or obese could also put you at risk. Excessive alcohol intake, smoking, exposure to
Those
radiation.
are the
So
lifestyles. Those are the lifestyles. Okay.
yes. So those family history you can't modify. Your age you can't do much about it. But for these ones, you
The
can at least
lifestyles.
modify
Yeah.
to reduce your risk, basically. Yes.
Oh, okay.
So for the breastfeeding, I said it decreases the risk because of the hormones. I mean, there are some myths going around that, when a man sucks your breast, it reduces your chance of getting breast cancer. It's not true. It's definitely not true. It's
Oh,
rather breastfeeding a child. Yes, I know it goes around a lot during Breast Cancer Awareness Month, but it's breastfeeding a child, like when you're producing milk after delivery. It suppresses, when you breastfeed, the you don't get your menses for a lot of people. So that reduces the hormones. So breastfeeding, not breast sucking, reduces the risk of breast cancer.
Okay. Doc, is there treatment? Can breast cancer be treated, and what are some of the treatments?
Okay, so in the asymptomatic time, when it's caught early, if you would notice, I didn't mention pain as a symptom because it's just about 5% of people that feel pain. So waiting for pain to show means like it's excessive. Sometimes for us, when we are not in pain, we don't go to the hospital. But when you start feeling pain with the mass, that means it's likely advanced. Yes, so catching it early when there are no symptoms. So that means it's caught through screening. Or as soon as you notice a mass, you don't wait, you go immediately to the hospital. When it's seen at that time, we can just take out the breast lump. You don't have to cut off the breast. That's the fear that people have. So then they tend to stay at home, and then it gets bigger and bigger, and then you come and there's no option than to take off the breast. So when it's caught very early, there's the option of just taking out the mass alone. And then you'd go through cycles of chemotherapy and radiotherapy. Then there's an option when you come when it's a bit advanced, and then they have to take off a breast or sometimes both. Yes. So even with the taking of the breast, I mean, some of the countries have the option of prosthetic breasts. So they give you something that you can fit into your breast so that you don't look too deformed, you know.
Yeah.
And other places also offer implants. So they take out the breast and they put out like an artificial breast for you to mimic the normal breast. They'll create a nipple and everything for it to look real. Depends on where you find yourself in the world. So I'd also want to talk about things to help prevent breast cancer. Okay, so a healthy lifestyle, avoid smoking, don't drink excessively, exercise. That could help. Try to have your children early if you have control over it. And then try to breastfeed at least for a year when you have children. Avoid excessive intake of hormones. I mean, the oral contraceptive pills have some hormones, but their levels are quite small. But if you keep taking the high dose ones, the emergency contraceptive pills, those have like over 100 times more estrogen than the normal contraceptives. So if you make it a habit of always taking the post pill, I mean, it also increases your chances of exposure to these hormones. So we have to take care of ourselves and then be proactive. Examine yourself, look at your breast, understand your breast, so that whenever there are little changes, you're able to pick it up and then go to the health facility as soon as possible. So that's the advice I would give.
Thank you, Doc. Yes, you just mentioned we should be proactive. It means we should know your body. You see, know your body. If you know your body, you will immediately there are changes you will know and examine yourself very well. You know, like you said, once a month would be a very good examination, self-exams for us. So the time has already gone fast. Doc, thank you very much for honoring our invitation. Is it possible to summarize it in Ghanaian language for us? Just 2 minutes, Doc.
Okay, all right. In yɛda mo ase sɛ mobɛka yɛn ho ɛnɛ yɛka breast cancer ho asɛm. Deɛ kae ne sɛ breast cancer no ɛyɛ nuform kokram a ɛba tissues ne bro so a ɛtumi cause cancer. Na deɛ ɛma nipa yɛ at risk sɛ ɛma nipa wei ade na nipa wei bɛnya cancer nipa wei nya cancer no. Risk no was soro sɛ woyɛ ɔbaa a ɛwɔ soro sɛ yehu ne ntɛm a yɛwɔ different treatment ebi soro sɛ yɛbɛtwa ɔmo nufoɔ. So wohu ne ntɛm a most of the time aba na ɛda nufoɔ nim a na yɛntwa nufoɔ no nto ntwene. Nanso ɛkɔ beyond saa no deɛ a ebi wɔ hɔ a there's no option ɛsɛ yɛtwa nufoɔ no. Na ɛno koraa nwie akyire no ɛnyɛ ɛno nko a ɛsɛ ɔkɔ through chemotherapy ɛbɛma wo nduru a cancer cells na aka na ebeku mmoa ni na ebeku cells na aka ni na nti other treatments you have to follow. Na ye cancer screening no bosumi bia oye bra na etwa by then nanufo no enye ya nti obetumi agina ahwehwe anim odo nsa kanufo na around na result aba and also enough onye professional nti bia bibi wo ho you may not see it nti at least once every year no obetumi you see October as a landmark once every year no wako hospital no mo ahwa ama na momudi 40 kona.
Look, thank you very much. Your time no. Your time no call. Enti the dog echeche mu nyina na wabɔ no etofa no. Osi if you 40 kono. But modern say obekɔ ayaresabia na wakɔ checke ohonam mu ane wunufo mu ahwɛ sɛ changes be abana. Thank you very much, Doc, for accepting and honoring our invitation. We really, really appreciate you and your time. Thank you for choosing to be part of the Golden Nest family. Together, we can create a world where our health is our first priority and wellness shines bright. Until next time, stay healthy and stay golden.